So if a massive suspension bridge collapses, right, the disaster is undeniably visible.
Oh, absolutely.
Yeah, the structural failure is just right there in the open. The damage is obvious and the emergency response is immediate. But right now, pediatric hospital wards are seeing double the number of teens admitted for the deadliest mental illness on record.
And the terrifying part is that you probably can't even see the damage happening in your own home.
Exactly. So welcome to the deep dive. We are jumping into some incredibly urgent source material today regarding adolescent mental health.
Right, specifically looking at a clinical advisory about a massive, completely hidden crisis in teen eating disorders.
Yeah, and we're also going through an operational overview of a systemic school-based solution currently rolling out in Georgia called MentalSpace School. And I mean, whether you're a parent, an educator, or just someone interested in public health, what these sources reveal is going to fundamentally challenge what you think an eating disorder actually looks like.
It really is a public health emergency. I mean, the
Yeah.
word emergency isn't hyperbole here at all.
Okay, let's unpack this because the clinical advisory sets the stage with a statistic that honestly should stop everyone in their tracks.
Mhm.
In the years following the pandemic, teen eating disorder hospitalizations double.
Yep.
Doubled. I really want to pause on that for a second. Doubled. We aren't talking about like a slight statistical variance here.
No.
We are talking about hospitals needing literally twice as many beds for adolescents suffering from this than they did just a few years ago.
Yeah, and if we look at the mechanism behind that specific spike, it was essentially a perfect storm.
How so?
Well, you had this sudden, profound loss of control during the pandemic lockdowns.
Right.
Adolescents, whose primary developmental goal is to gain autonomy, suddenly had absolutely none. They were trapped.
Oh, wow. Yeah, that makes sense.
So for many of them, controlling their food intake or, their exercise routine became the only way to manage their profound anxiety.
And they were totally isolated.
Exactly. Because of the isolation, these behaviors just became entrenched without the usual social safety nets around to notice.
Like teachers or coaches.
Right. Teachers, coaches, extended family. Nobody was there to see the early warning signs.
And we really have to pair that doubling with another fact from the clinical data that I think completely shatters the public perception of this illness. Eating disorders carry the highest mortality rate of any mental illness.
Higher than depression, higher than schizophrenia.
Wait, really? The highest?
Yes, the highest. The physical toll on the human body, when you combine it with the severe psychological distress, it just makes it exceptionally lethal.
But there's this pervasive cultural mindset, and I mean, I've caught myself thinking this way in the past, that eating disorders are just a phase.
Oh, totally. A lot of people think that.
Or like a vanity issue, right? A teenager gets a little too obsessed with a magazine cover or a TikTok trend, and eventually they just grow out of it.
And that assumption right there is exactly why the traditional wait-and-see approach is so actively dangerous.
Because normally waiting is fine.
Right. In a lot of areas of adolescent development, waiting to see if a behavior resolves itself is actually standard practice. It's often the best practice.
Like if a teenager gets moody, you give them space.
Exactly. Or they try some weird fashion trend, you just ignore it and it passes.
Okay.
But with eating disorders, the sources are incredibly clear on this. Waiting and watching is actively harmful.
So why is the wait and see approach specifically so dangerous here? Like, what is actually happening in the body or the brain during that waiting period?
It comes down to neurobiology. When a teenager engages in severe caloric restriction or purging, the brain literally goes into starvation mode,
Okay.
and that alters their neurochemistry. So the behavioral patterns, like the rigid rules about food, the intense fear of eating, they become deeply entrenched neural pathways.
Oh, I see.
Yeah, the longer the brain is malnourished, the harder it is to rewire those thoughts. So early intervention isn't just about, stopping weight loss. It's about interrupting a psychological cycle before it becomes permanent.
It is quite literally life-saving.
Absolutely.
But catching it early kind of implies you can actually spot the problem in the first place.
Right.
And according to this clinical advisory, our traditional methods for spotting eating disorders are failing spectacularly.
They are completely outdated.
Yeah.
If we connect this to the bigger picture, the advisory notes a massive shift towards something called atypical anorexia.
Atypical anorexia.
Yeah. And the crazy thing is, it is now the most common eating disorder presentation in adolescents.
Which kind of feels like an oxymoron, doesn't it? Like, how can something be atypical but also the most common?
I know, it's an antiquated medical term that just hasn't caught up to reality yet.
Right.
Atypical anorexia involves the exact same severe restrictive eating behaviors
Okay.
and the exact same dangerous cognitive patterns as traditional anorexia, but
Right.
without the underweight body status.
Okay, wait. So you have a teenager who is practically starving themselves, terrified of gaining weight. Their body is in severe distress, but because they started at a higher weight, they just don't look emaciated.
Precisely. They don't look sick. They might drop, say, 30 pounds in 2 months through severe starvation.
Wow.
Their heart rate is dropping dangerously low. Their hair is falling out. Their internal organs are under immense stress. But when they go to the pediatrician or the school nurse, what actually happens?
They step on the scale.
Right. They step on the scale, and their body mass index, their BMI, still registers as normal or even overweight.
Oh my God.
And then the doctor actually praises them for the weight loss.
Are you serious? So they are literally being congratulated for their eating disorder by medical professionals.
Yes, because our medical system relies so heavily on BMI to flag these issues. When a school nurse or a doctor relies solely on a weight chart, they are missing the vast majority of suffering adolescents.
That is wild.
The malnourishment is happening, but the visible red flags we've been trained to look for just aren't there.
It's like having a smoke detector in your house, right? That only goes off if it sees actual flames, but it completely ignores the room filling up with toxic carbon monoxide.
That is a perfect analogy.
The danger is already there. It's just invisible to the sensor you're using.
Exactly.
Here's where it gets really interesting, though, because that shift means the demographics of who we are looking at and who we are completely missing have dramatically changed, too.
Right.
The source talks about how we need to shatter our cultural script.
The cultural script is basically the stereotype we've all internalized.
Right.
When you hear the term eating disorder, society generally pictures a thin, affluent, white teenage girl.
Yeah, from like a movie or something.
Exactly. But the clinical reality is that these disorders happen at every body size, in every gender, in every single race, and across every economic background.
And there is a statistic from the source here that proves just how wrong that script is. 1 in 3 people with an eating disorder is male.
1 in 3.
That is huge.
It really is. And yet, how often do we screen adolescent boys for this? Almost never. Boys are frequently missed entirely.
Yeah, they're missed in boys, missed in athletes, high-achieving students of color.
All the time.
But what really jumped out at me in the source material is why they are missed. It isn't just a lack of screening, right?
No, it's more complicated than that.
It's that so many of the modern warning signs masquerade as discipline, like they hide behind this socially acceptable veil of health and wellness.
And that is arguably the most insidious part of this whole shift. As a society, we are actively praising the exact behaviors that are destroying these kids.
Okay, I want to push back on this a little bit, or at least clarify, because the sources give a list of warning signs that honestly challenge you to rethink everything.
Yeah, they do.
For instance, they list the sudden adoption of vegan or gluten-free diets without an underlying medical reason.
Mm-hmm.
But how do you distinguish between, say, a teenager who watched a documentary and genuinely cares about animal rights or the environment, and a kid who is just using veganism to hide an eating disorder?
That is such a vital question.
Yeah.
The distinction really lies in rigidity versus flexibility and the level of distress involved.
Okay, walk me through that.
So if a teenager decides to go vegan for ethical reasons, but they go to a friend's birthday party and accidentally eat a piece of cake with dairy in it, they might be annoyed, right?
Sure.
But they move on.
Yeah.
It's not the end of the world.
Right.
But if a teenager is using veganism as a socially acceptable way to restrict calories, accidentally eating that cake will trigger a severe panic attack.
Oh, wow.
The diet is a shield. Cutting out entire food groups like veganism, gluten-free, dairy-free, it basically gives them a socially unimpeachable excuse to refuse food in public.
That makes so much sense. It's the psychological rigidity behind the choice. We see a kid turning down pizza for a salad, and we just think, wow, they're so disciplined.
Exactly. Or we see an intense obsession with clean eating, and we applaud them for taking care of their bodies.
Meanwhile,
Internally, their cognitive state is entirely consumed by a sheer terror of eating the wrong thing.
and it extends to physical activity, too. Like, the sources explicitly mention excessive exercise, but specifically secret exercise, or exercising while sick or injured. And this concept of exercising to earn the right to consume food.
Think about the male athlete demographic we just discussed, right?
Right.
You have a high school wrestler or a track star who runs an extra 5 miles at midnight on a sprained ankle,
Oh, man.
and the coach praises his dedication and grit. He's a star player.
Right, he's just working hard.
But mechanically, what's actually happening, he isn't training. He's compulsively burning calories to alleviate the overwhelming guilt of having eaten dinner.
Wow. When you look at those behaviors through the lens of atypical anorexia, you really realize the massive danger of our cultural script.
We completely miss the illness because we are applauding the symptoms.
So what should adults actually be looking for then? Like, if BMI is useless and healthy eating could just be a mask, what are the actual physical and social warning signs?
Well, the clinical advisory outlines very specific indicators. Physically, weight fluctuations in either direction are a major red flag.
Wait, either direction?
Yes. Rapid weight loss, rapid weight gain, or bouncing between the two.
Okay.
Because that indicates the body is in severe metabolic distress. But honestly, the social signs are often the earliest predictors.
Yeah, the sources mention things like skipping family meals or suddenly finding excuses to be in the bedroom doing homework right when dinner is served.
Right. And broad social withdrawal from food-centric events.
Like what?
Like if a teenager suddenly stops wanting to go to sleepovers or holiday dinners, or they avoid the school cafeteria entirely, that is a glaring warning sign.
Just a kiss of the food.
Yeah, they aren't just becoming introverted. The anxiety of having to navigate a food environment without their strict rules is just too overwhelming, so they isolate.
And then there are the more severe physical indicators that adults absolutely must not ignore, right?
Absolutely.
Frequent bathroom visits immediately after meals, evidence of vomiting or laxative misuse,
Yes.
coupled with excessive calorie tracking, frequent weighing, compulsive measuring, or constantly checking their body in mirrors.
Body checking.
Right, which the sources refer to as body checking.
And notice that every single thing you just listed is a behavioral or cognitive sign.
True.
They have absolutely nothing to do with what the child's BMI happens to be on a Tuesday in the nurse's office.
Yeah. So if you are listening to this and you're starting to realize how easily these behavioral signs can hide in plain sight, I mean, maybe you are picturing a student in your classroom right now, or your nephew or your own child. The immediate terrifying question is, how do we actually catch this before it's too late?
Well, the clinical advisory is unequivocal on this.
Yeah.
If you have any concern at all, you must screen immediately.
No more waiting.
The wait-and-see window is totally closed.
And this is where the source material provides a really highly practical, immediate tool.
Yes.
There is a free 2-minute eating concerns screening available right now.
Right, at messtherapy.com for mental health tests.
Exactly.
And what makes this specific screening so vital is that it is engineered for this exact new reality.
It completely bypasses weight charts, doesn't it?
Yes. It ignores BMI entirely. It captures those cognitive and behavioral risks we just discussed.
Okay.
It asks questions designed to uncover the psychological distress, the rigidity, the guilt, the fear, providing instant scoring and referral guidance.
It doesn't wait for a physical collapse.
No, it catches the smoke before the fire.
I want to speak directly to you for a second, the listener. If you are a parent listening to this, the advisory suggests taking this test alongside your child, if that feels appropriate, or taking it on their behalf based on your observations if it doesn't.
Just to get a baseline.
Yeah, the point is simply to know. And if you are a school nurse, a counselor, or part of a school-based health team, you need to update your intake materials immediately.
Weight-based screening in schools is simply no longer sufficient.
You can add this link to your wellness pages, your parent communications, your intake forms.
There is a quote from the source material that perfectly encapsulates the urgency here.
What's that?
It says, "The cost of screening is 2 minutes and $0. The cost of waiting can be much higher."
Man, that gives you chills. Because the cost of waiting is quite literally a life.
It really is.
But catching it is only half the battle, isn't it?
Yeah.
I mean, knowing my child is sick does me no good if every specialist in a 50-mile radius has a 6-month wait list.
Oh, exactly. This raises an important question. How do schools or parents actually handle the influx of needs once we start screening properly?
Right.
That is the exact bottleneck that causes the entire system to fail.
Finding the problem is just step one.
But access to care is a massive, massive hurdle. You find out your kid is struggling, you call a therapist, and they tell you they have no openings until next spring.
Or they don't even specialize in it.
Right, they don't have specialized experience in eating disorders, which requires highly specific clinical competency, by the way. Or they simply don't take your insurance.
Which just forces families right back into that dangerous wait-and-see period by default.
Exactly, because they have no other choice.
Which brings us to the second half of our source material today, the operational overview out of Georgia. We are looking at a systemic solution currently being deployed to address this exact logjam. It's called MentalSpace School.
And the Georgia model is fascinating as a case study.
It really is.
MentalSpace School is a K-12 mental health support system
Yeah.
operating directly within the school environment.
Okay.
It is entirely engineered to completely remove the friction between identifying a problem and initiating care.
So how does it practically operate day to day? Like, let's say a student takes that screening we just talked about and it flags high risk for atypical anorexia. What actually happens next in this system?
Well, when a screening suggests concern, MentalSpace School offers same-day teletherapy intake.
Wait, same day?
Same day.
That is almost unheard of in mental health care. I mean, usually you're waiting weeks or months.
It is a complete paradigm shift. We are moving from "we'll see you in 3 months" to "we will see you this afternoon."
Wow.
By routing families directly from a digital screening into immediate care, you fundamentally change the trajectory of the illness.
Because you don't give the brain time to lock it in.
Precisely. You attack the behavioral patterns before they become deeply entrenched.
But, okay, let me play devil's advocate here for a second.
Sure.
Teletherapy for an eating disorder. We established earlier that this is a highly physical illness with the highest mortality rate.
Yes.
How does a therapist on a laptop screen monitor malnutrition or organ stress?
And that's where the integrated model comes in.
Okay.
MentalSpace School isn't just like a random hotline you call.
Mm.
They provide dedicated therapist teams for each specific school.
Oh, so they know this school.
Right. And these are specialized ED experienced clinicians who actually coordinate directly with the school nurses and local medical providers.
I see.
They form a collaborative care team. So the therapist handles the behavioral and cognitive therapy while constantly communicating with the pediatrician or the nurse to monitor the physical vitals.
Okay, so it's building a complete safety net around the student.
Exactly.
And the sources detail that these are licensed, diverse, and culturally competent therapists.
Yes.
Why is that specific detail cultural competency so important in the context of eating disorders?
It goes right back to the cultural script we discussed earlier.
Right.
If eating disorders are consistently missed in boys and students of color, having a diverse therapeutic team is crucial.
That makes sense.
I mean, a black male athlete struggling with compulsive exercise and dietary restriction is going to have very different cultural pressures and stigmas to unpack
Yeah.
than a white female dancer.
Absolutely.
Having a therapist who inherently understands that cultural context drastically improves the therapeutic alliance and ultimately the outcome.
And it's not just eating disorders, right?
Yeah.
The operational overview notes their services cover crisis intervention, suicide and violence prevention, family counseling, and even staff wellness.
Yeah, it's a holistic approach to the entire school ecosystem.
They're even set up to help Georgia schools meet the upcoming HB 268 compliance deadlines hitting in July 2026.
But of course, the elephant in the room with any systemic intervention like this is cost.
Oh.
Who pays for this? How do families afford specialized care, especially in a school setting?
And that's usually where these programs just completely fall apart.
Yep.
But the source text lays out their financial structure, and they've somehow managed to untangle the insurance nightmare.
They really have.
They accept all the major commercial plans in the state, like BCBS, Cigna, Aetna, UHC.
Right.
And for families on Medicaid, the out-of-pocket cost is exactly $0.
Which is just incredible. They've removed the financial roadblock entirely.
So what does this all mean? We have a system that identifies the unseen behaviors, provides same-day access, ensures cultural competency, and drops the cost to $0 for the most vulnerable families.
The Holy Grail, basically.
Right. But what are the actual tangible results of this integrated approach?
Let's look at the numbers.
The source data provided gives us the outcomes, and they are frankly staggering. Schools utilizing MentalSpace School report an 89% improved attendance rate.
Wow.
And they're seeing a 92% reduction in anxiety among the students.
Those numbers really warrant a closer look because they explain how this model works on a practical level.
Yeah, break that down for me. Why does attendance improve by 89%?
Because integrating therapy into the school day physically removes the barriers to attendance.
Oh, right.
Kids don't have to leave campus for a midday appointment. Parents don't have to miss work to drive them across town.
That is huge for working parents.
It is. Furthermore, a massive driver of chronic absenteeism is school refusal, which is usually rooted in severe anxiety.
Like the anxiety of facing the cafeteria when you have an eating disorder.
Exactly. So a 92% reduction in anxiety directly correlates with a reduction in the rigid, obsessive cognitive patterns that fuel the illness.
Which in turn allows the student to actually physically remain in their educational environment.
Exactly. By removing the friction of finding an in-network, competent specialist, schools and parents bypass that deadly waiting period entirely. They treat the student in situ.
We've unpacked a tremendous amount of crucial information today.
We really have.
We started by confronting a pretty terrifying reality. A post-pandemic world where teen eating disorder hospitalizations have doubled, driven by an illness with the highest mortality rate in mental health.
And we examine the mechanics of how the presentation is fundamentally shifted toward atypical anorexia.
Right.
We saw how severe malnourishment can occur in bodies of literally any size, making traditional weight-based screening essentially obsolete.
Yeah, we broke down the hidden behavioral signs that so often masquerade as discipline or veganism or clean eating, and explored how these narrow cultural scripts leave boys, athletes, and students of color completely overlooked by the medical system.
We also highlighted the critical need for immediate modern screening.
Pointing everyone to that zero-cost behavioral assessment at shuckstherapy.com mental health tests that ignores BMI to find the actual psychological risk.
And finally, we explored the operational mechanics of MentalSpace School in Georgia.
Right, proving that when you combine immediate teletherapy, specialized clinicians, and $0 Medicaid access right within the school walls, you can actually dismantle the logistical hurdles to care.
You can intervene early, and you can save lives.
Yeah.
As we wrap up this deep dive, I want to leave you with something to consider.
Okay.
Our sources showed us how the narrow cultural script of eating disorders blinded us to atypical anorexia.
Right. We miss the sickness because society praise the discipline.
Exactly. Well, today, our broader culture is increasingly normalizing constant biometric optimization.
What do you mean?
We celebrate people tracking every calorie, every macro, and every single heartbeat through smartphone apps, wearable fitness rings, and smartwatches.
Oh, wow.
So if we aren't careful, we really have to ask ourselves, are we inadvertently providing the perfect, socially acceptable, technologically advanced camouflage for the next evolution of eating disorders to hide right out in the open?
Man, it really makes you look at that fitness tracker on your wrist a little differently, doesn't it?
It sure does.
Just like the smoke detector that only looks for visible flames. Maybe we are building a world where the toxic smoke is just considered a normal part of the atmosphere.
Something to think about.
Thank you so much for joining us on this deep dive into the source material. We will see you next time.